if you've gone to the doctor and you've been having pain, you're in the 40s, you're in your 50s, even maybe your late 30s, and you've been having achy pains, achy knees, shoulder pain, and like hips, joint pains, and you've been told like, here's some ibuprofen. Go ahead, take the ibuprofen. You'll be fine. That might not be the entire story about what's going on with you. You could be in perimenopause, and there's more to perimenopause than ibuprofen, go rest, and just deal with it, sis, right? There's more to it. So today we are going to go over what is going on during this phase in perimenopause, menopause that's causing this aches in the shoulders, aches in the hips, aches in the knees, right? And why you can't throw your hands in the air and wave them like you just don't care because you got one good shoulder. We're going to talk about what's happening, why it's happening, and most importantly, what are some of the things that you can do to support yourself during this phase called perimenopause and menopause. Hi, I'm Dr. Tamara Beckford, and welcome to Menopause Stories Podcast. All right, so joint pains and stiffness. Now, I don't know about you guys, but I know that for me, during around closer to the 40-40 club that I have entered a couple of years ago. I'm on my way out of the 40-40 club, for those of you guys who are wondering. But I'm definitely right in the 40-40 club right now, and which means that I am in my 40s. But I do remember, I was during the time of the late 30s, I had a trainer, was working out pretty consistently, right? Working out pretty consistently. Then one day, it was in the spring. How can I forget? It was 2020, March of 2020. I just started having a pain and discomfort in my left shoulder. I thought, you know what? This must have been during that time when I was doing that bench press that I remember putting down the weights, and I was super excited because I'd been able to work my way up to this particular weight level. Put the weight down, and I think I'm like, I probably overextended that shoulder. Still had some aches and pains going on. And eventually I went to the orthopedic doctor, got x-rays done, all these things. Everything looks fine on the inside, right? Calcific tendonitis, you got a little bit of calcium going on in those tendons. But that happens with age. Okay, thank you. But hey, that's what's going on. Now, many years later, still noticing that discomfort. Plus, other things start happening. But when you start to add those things together, I realized that discomfort that happened in my left shoulder was frozen shoulder. Now, my shoulder's not completely frozen. I do have range of motion in it, but it's not at the same level as it was before. Now, the thing is, my story is so similar to a lot of you ladies out there, right? Where we started having discomfort in the shoulder and you attributed it to something else. Now, I know that one of my guests on this Menopause Stories podcast says the same thing. She said, I woke up in the middle of the night. I thought, you know what? Maybe I did something. Maybe I injured myself. We are not thinking that this could be part of what we call the musculoskeletal, different part, musculoskeletal syndrome of menopause. Now, what happens with that? We can have some joint stiffness that's noted, right? So we have some stiffness in the joints, and a lot of times this can be in our shoulders. You can also notice them in your hips and also in your knees. Now, I know a lot of us, we remember the time when we were able to really go about and dance and boogie, woogie, woogie all the way down to the floor and work your way back up. But nowadays, you might be able to work your way not completely to the floor, maybe just at chair level, right? And then if you're at chair level, you said, you know what, I might as well sit down because it's not going down and not coming back up. But this is all secondary to the fact that we have inflammation that's going on in those joints. Now, when we think about it, when we have these joint stiffness that's happening, in the shoulder, the hips, and the knees. That's, something that's disturbing, that's limiting some of our motion. We talked about the frozen shoulder as being one of the most common areas, but then also things that happen in perimenopause and menopause that we also don't think about is muscle loss, right? So muscle loss is something that we have to keep in mind that can be attributed to this point in time. Now, you're having muscle loss, you're having joint pains, and you're having inflammation. Like, what's going on? Like, how did my body just all of a sudden turn into this thing? Well, let's talk about it. Now, we have this wonderful hormone within our body, and I mean, she is our friend to the end because she eventually goes down and her levels start to decline. And what I'm talking about is our lovely lady. Her name is estrogen. Now, estrogen is one of our hormones that we have within our bodies. Both male and female have this hormone. And for us women, a lot of time we are taught about estrogen as it relates only to a few parts of our lives. One, during puberty, it's like, oh, you're now becoming a lady because you have started your period. Estrogen levels are there. You're starting to develop the breasts and also the hips. And you're like, yes, welcome. And then we talk about estrogen during the time of pregnancy. Oh, wow. Estrogen levels rises. You have a baby that's developing on the inside. We talk about estrogen during those 2 points in the women's life. But what we fail to talk about is the third portion, which happens during menopause. And it actually starts to happen during perimenopause, which is the decline of estrogen that happens within our bodies. Now, this decline happens not in a steady fashion, right? So we're not talking about like the slope that's just going down. We're not talking about the slide on the playground where the estrogen is just going down and the slide on the playground. It goes down in a very undulating fashion. So it's up and down. Now, the fact that it's up and down, it relates to some of the things that we ourselves experience, such as the mood disruption. The fact that it's going down, we start to lose some of the protection that estrogen has within our body, especially as it relates in this episode to our joints, our muscles, and the inflammation that we have, which is the achy pain, right? So when we think about us having the frozen shoulder, when we think about the inflammation in the bursitis, we'll talk about that too. And the muscle loss, it's attributed to the decline in our estrogen within our body. Now, what does estrogen do? Like, how is she related to our joints? What's going on? Estrogen, she has this very protective mechanism within our joints. So one thing that she does is we recognize that our joints have this layer, a protective layer, and almost a cushioning around it. And that cushioning is the cartilage. So the estrogen helps to protect our cartilage, keep it nice and pliable, right? Keeping us to be able to stretch and to move about. That's what she does. Now, when her levels starts to drop, we don't have as much flexibility in that cartilage. And as a result, with us not having as much flexibility, it starts to become stiff. And then estrogen also helps to decrease inflammation. So when she is not around, inflammation starts to go up. When inflammation starts to go up, inflammation usually causes thickening and of whatever is around it, right? So the cartilage is not moving. You don't have as great mobility, but you're having thickening, and the inflammation usually causes, on a deeper level, it's almost as if it's a scar. So therefore, you're not able to move your shoulder around as much. Or if it does, you are able to move it, you have discomfort, you have pain. And that's what's going on in that shoulder. That's what's going on to cause it to feel stiff. And that's what's going on in the hips and also in your knees. So here's the other thing. Bursitis within the hip and even the shoulder, we talked about the movement, which is the cartilage, but it also has a nice little lubrication portion in the bursa. And the bursa is, if you think about a joint and even on your bicycle, remember you used to put the oil on the bicycle, the chain, so that it can move around, right? Kept it lubricated. So in the bursa helps us to keep our joints lubricated. So that same oil that you usually do, a little bit of oil on your chain to keep that bicycle moving and keeping it nice and flexible. That oil, think about when you have stopped adding the oil to the bicycle chain, right? Think about it's now been 2, 3, 4 years, and you try to ride that bicycle. That chain is stiff. You can barely move it. And then even some akin, you might even end up, the chain can break. So think of that chain as being like some of the what's going on within our joints. Without the lubrication, it stiffens. And if you keep pushing at it, you can get tears. So it's similar. So that estrogen is part of that lubrication that occurs within our joints. So without it, that's why we're having that. Now, I don't know about you. The worst part of this process is that sometimes you do not see it coming, right? So we talked about the shoulder, and now we're talking about bursitis. I don't know if you've ever had this. Have you ever woken up with just a huge amount of pain in that joint? For me, it was a hip. Again, I'm exercising. I blamed it on exercise. We know we should exercise, right? And then you get injured and you're like, it's because I exercised. But this one, no, it was actually related to the decline in estrogen within the body. So the inflammation, as we discussed, we talked about inflammation in the shoulder joint, the same bursa can occur in your hips. So you can wake up and you just have this really sharp pain in that hip. You can't put your foot down. You can't do anything. That's when you need to go and get evaluated, right? So bursitis, that's it. Bursitis, which is an inflammation of the bursa, and the bursa is a nice little lubrication centers in our joints. So bursitis is one of the beautiful byproducts of being in perimenopause or menopause. But the great thing is that you are hearing about it, right? So as much as it's like, oh my God, I cannot believe this too. Okay, yes, it happens. But we're discussing it so it's in your mind. When you go to the doctor, you can say, hey, I'm wondering, could it be this? And could it be related to this portion of my life, right? So we're not going to look at it as a super negative. We're going to look at it as information and yes, I know about that. So we've talked about estrogen. We've talked about its decline and how its decline can lead to inflammation. And the inflammation can lead to joint stiffness and especially frozen shoulder, bursitis in the hips and also the knee. But there's another important factor that happens during this portion of our lives, this perimenopause, menopause portion, right? And it's also related to a decline in estrogen. And the next thing that happens is such an additional important part, and it is the muscle loss. So our muscle loss. Now, during this whole time, none of us were really thinking that there are estrogen receptors within our muscles. It's just like, yeah, you need to make sure you exercise as you get older. And, you've probably heard like, oh, well, once you hit your 20s, you're at the peak that you'll ever be. Make sure that you're eating properly and make sure that you're building muscles because from there, it's just a downward slope. And the reason is because our estrogen levels start to decline. So with the decline in estrogen, we start to lose muscle mass. There's a medical term for that called sarcopenia. But just know it means that we start losing some of our muscle mass. And our muscle mass is so important, especially for us ladies, because as we get older, we know our muscles help to support our joints and our bones, and the weakness that occurs when we don't have that muscle is what increases our risk of fall and of fracture. And one of the things we've discussed also is if you fall and you fracture, especially the hip, as a woman, like each year that you're older, so in your 30s, but if you're in the 50s, 60s, 70s, for every decade, you have increased your risk for mortality, which is saying another way of saying that you're in a risk of dying secondary to that, almost like 25%, like between 23 and 25%. So it's super important for us to make sure that we have our muscle tone so that we can support our joints, so that joints can support our bones, so that we can decrease our risk of falling and of fractures, especially of these long bones, which are so important, such as the hip, right? So muscle loss starts to occur because of this decrease, as we talked about in the estrogen, because receptors are there. Muscles have estrogen receptors. So we need to make sure that we are doing things to keep our muscles healthy, and in order to make sure that we can prevent this mortality issue that can happen with falls. Now, when we think about it all in all, you're just probably like, geez, Louise, Dr. Beckford, there's just so much going on. How can I make sure that I am like at my best? Like, I don't know what to do. I feel like all is lost. I've asked the question recently on, a poll on social media, like, hey, if, what is something that you wish you knew about menopause that no one told you? And someone was like, oh my gosh, I just feel like I don't even want to come in because it just sounds like the worst thing ever. And like all is lost. And I'm like, no, all is not lost. What we have right now is the benefit of knowledge. We have the benefit of information that a lot of our moms, our aunts, our granddaunts, they didn't have that information, right? And we have newer research that's out. We have newer ways to improve upon what they have done during their lifetime, right? So we can improve upon that so that we can have a better quality of life, and also be able to not only to extend the life, because this portion now we're in that phase in life where we're going to embrace. We're so wise. We have tons of experience, right? We've put in many, many years into learning, into experience. So we don't want to look at the latter years, which is, we say latter, but it could be 30, 35 years, right? We can't look at this 30, 35 years coming up as the doom and gloom. No, we're going to look at it with excitement because we now understand what's going on, right? So with that in mind, what are some things that we can do in order for us to say, you know what, Dr. Beckford, I'm going to experience these years as my best upcoming years yet. So we're going to do it the MEND method, right? MEND, MEND. So with the MEND method, we are going to move intentionally. So we're going to move intentionally. That means move with purpose. I'm a doctor. You know how it is. We don't like writing out the whole thing. So this C means with. Move with purpose. And with the E, we're going to eat to decrease inflammation, because we know that estrogen is already decreasing. And when estrogen decreases, inflammation increases. So we're going to be conscious about what we eat. So we're going to eat to decrease inflammation. But we also, so that means that, yes, we're going to be paying close attention to the vegetables. We're going to be paying close attention to the meals. But most importantly, we need to ensure that we have enough protein. Now, I know some of you might be like, oh, that's juxtaposition, Dr. Beckford. I mean, if I'm eating animal protein, aren't I increasing my inflammation? If you don't like animal protein, then eat plant protein. Beans. There's some berry mamma jammas, because beans, the smaller the beans, the mightier the protein source. So think about it. But it's important that you have enough protein because we need to use the protein to build the muscles, right? So yes, I know you've heard about like the amino acids. So the amino acids are the precursors to the proteins. So we need the proteins that help to build the muscles. So the proteins are the building block of our muscles. And that's why you keep hearing all this protein. It's the building block. So yes, we are going to eat to decrease inflammation, but yes, we're going to also ensure that we have adequate protein intake in order to build our muscles. So N is we're going to normalize our hormone. Now, here's the thing. If all of your hormones are out of whack and you have done all the natural ways that you can to try to supplement your hormones and you are still at subpar level, you are still suffering from all the inflammation, the joint pains, and all the other things that come along with perimenopause and menopause, because we're talking about joint pains and stiffness, frozen shoulder today, but we know that estrogen decrease causes so many other things, especially the hot flashes and all that. If you have done all that you can from a supplementary standpoint and you are still having discomfort, as one of my colleagues says, I have used everything in my arsenal and I still am not feeling like myself. Now, this is someone who she uses very, very natural ways to heal herself. She's a coach. She's a mindfulness. She knows how to do the meditation. She knows how to use her coaching skills to help herself, how to help her anxiety, how she knows how to do all of this. She has been using her skill set on herself, but she still does not feel like herself. She's finding that she's having very, 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 very hard time concentrating, hard time finding the motivation, the love. She's starting to lose the love for what she does. That's not related to the fact that just one day she woke up and she's just not herself. No, it's related to the fact that her hormones are subpar. They're suboptimal. And therefore, no matter all the things that she has done on her own, the natural way, she still needs at this point some supplementation. So normalizing the hormone, I want to say this to you ladies, it is okay. It is okay if you have done it all on your own and you need support. That's what people like me, Dr. Beckford, with Truly Balanced Wellness Care, that's what we do. That's why we're here for you. Do not feel as if it's a personal failure. Please do not. Do not feel like it's a personal failure. Okay, we're here to support you. So normalizing those hormones is another thing. So MEND, and D is the most important. Make sure you see someone who can design a personalized care plan for you. Now, the thing is, you're an individual, so it's not a one size fit all, right? So what works for you might not work for the other person. What worked for your friend Amy might not work for you. What worked for your cousin Sally might not work for you. What about your Aunt Mary? Yeah, that plan worked for Aunt Mary, but Aunt Mary and you are two different people. So getting a plan that's a personalized, designed plan that works for you might be just what you need to get you through this period. So don't forget that you can mend, right? You can definitely move with purpose. You can eat to decrease your inflammation, but keep in mind that you got to get those proteins that's needed to build those muscles, normalize that hormone, and design a personal plan. Get one that's designed for you. Now, with today's session, I hope it makes complete sense to you as to where is my joint hurting? Why cannot I throw my hands in the air and wave them like I just don't care? You can't do it because the estrogen dropped and it's causing inflammation in the joint and you have stiffness in those joints And if you throw your hands in the air, well, the fact that you could throw it in the air, that's great. But waving them like you just don't care might just not happen, right? But understanding why it's so important, understanding how to help to support it is even better. And know that there is support out there for you, ladies. The reason why we have this podcast is to let you know that you are not alone, right? There are other women who are feeling the same way. So don't feel like you need to isolate yourself. Don't feel like this is oh, it's just me. No, we are here in this together. We are going to make this latter years our better years. So as great as this first portion of our life was, we're about to step it up in the second part. And with that, we're going to end today's version of Menopause Stories Podcast. I cannot wait to see you guys on the next episode. And remember, if you're looking for great care in this perimenopause or menopausal season, I'm Dr. Tamara Beckford, and I would love to take care of you. Give us a contact. Go online at www.trulybalance.com, and we will see you then, right? So that's Truly, TRULYBALANCEDWC.com. Book that complimentary call. I'd love to take excellent care of you. Bye-bye.